Many of you may have been diagnosed with seizures, and this is actually not uncommon. And some of you may have gone to several neurologists and been told that you have seizures. And then you may have also found out that you're diagnosed with what they call non-epileptic seizures. These are spells where the electrographic record does not show actual epileptic activity, even though physically you're experiencing convulsions. And so today, I'm just going to have a very brief conversation regarding a sometimes frustrating topic called non-epileptic seizures. Um, so, in general, seizures are electrical storms. There are electrical short circuits, if you will, in different parts of the brain, and sometimes they may involve the entire brain. The interesting part is that the outward manifestation of seizures may look the same whether there is an actual electrical storm or whether there isn't, meaning patients appear to be convulsing. They may even have loss or change in their level of consciousness or mental status. They may even be foaming at the mouth. And they certainly look like they're having a seizure. But when you do the test, when you do the EEG, which is the recording of brain activity during a spell even, you don't see any abnormal electrical activity. So how can that be? How can someone have what looks like a seizure, but not be a seizure? Well, that's what neurologists call non-epileptic spells. And this is very frustrating for both the patients and the doctors because the patients are wondering, then why am I having these spells? And the doctors are like, well, I don't see anything wrong with your EEG. Yes, I see that you're having spell. There may have been a camera recording of it. And clearly people have witnessed you having a spell, but there's no actual epileptiform activity. So in many cases, doctors are stuck. However, there's now been a ton of research and a lot of investigation into these types of disorders. Some would call it functional neurologic disorders. Some would call it, again, non-epileptic spells. But what I wanted to tell you is that do not be dissuaded or disappointed if some doctors may be dismissive. And unfortunately, some of my colleagues may be telling you that you're quote unquote faking it or these are not actual spells. But studies show that there are actual electrical changes occurring in the brain, and there are circuits in the brain that are abnormal in patients who have non-epileptic spells. It's just that it's different than the classic epileptic form activity. So, what causes then these non-epileptic spells, and how do you treat them? Of course, those are the quote unquote $1 million questions and answers, right? Well, if you really talk to the patient, if you really investigate and have a nice in-depth conversation with the patient and often with the family members, you will find out that there's more to the story. In many of these patients, they have suffered perhaps some sort of a trauma in their life, whether it be PTSD, whether it be some sort of a psychological trauma or even physical trauma or even concussions. And the circuits in the brain, specifically in the prefrontal cortex, the very front of the brain, have been altered or injured. And there's a pathological state. There's a pathological connection between the prefrontal cortex and deeper structures of the brain that can lead to these spells. And no, the patients are more often than not faking it, and they're actually experiencing real spells. Here at my office, we try to use more precise measuring, including quantitative electroencephalography, which goes a bit further than the routine EEG analysis. And we often find on these types of imaging clear abnormalities when compared to a normal population, especially in the areas that control pain, that control suffering, i.e. the insular cortex, the prefrontal cortex, especially the dorsolateral prefrontal cortex, sometimes the orbital frontal cortex, and often the amygdala. So I want to tell those patients who have been frustrated with their doctors, perhaps, and even doctors who have been frustrated with their patient, that there are real findings. If you do quantitative EEG, sometimes functional MRI studies, you can see actual changes that differentiate these patients from a normal population. fact that we should not be dismissive of these patients. And as many of my colleagues know, these patients also, in many cases, experience epileptic spells mixed in with their non-epileptic spells. And there's been tons of research that shows this. So on the treatment side, a lot of these patients are shunted off into psychiatrists who try to diagnose patient with some sort of psychiatric disorder. And in many cases, they can't find one. The patient does not really say that they're suffering from depression. They don't have any signs of a psychiatric disorder. And so they're then shunted back to the neurologist. So this back and forth goes often, and it's very frustrating. What I try to do at my office, and I encourage many of the other colleagues of mine to also encourage, is to take these things seriously. The treatment I try to use is brain modulation. By brain modulation, I mean restoring to normal these circuits in the brain that are found to be abnormal. And there have been studies that show that these types of non-invasive modulation, brain modulation treatments can in fact work. The one I use often is transcranial magnetic stimulation, as many of you know. TMS is nothing more than electromagnetic pulses that are externally applied to specific and targeted regions of the cortex. And in many of my patients who have suffered from non-epileptic seizures or perhaps other functional, as we call it, neurological disorders, this has been tremendously helpful. And so for those of us who see these patients, I don't think we really need to be frustrated, because more often than not, there are some solutions. And by the way, TMS or brain modulation with TMS is not the only answer. Sometimes I see patients do well with neurofeedback or biofeedback, as some people call it. Yes, and sometimes some patients do require the use of certain medications. We do find that patients can reach some form of relief, and so it's not a complete loss. The other part of this is that, again, some of these patients may experience other types of spells that mimic convulsive seizures or epileptic spells. Some of them include syncopal spells or convulsive syncope, where there's poor blood flow to the brain causing an actual muscle convulsion or whole body convulsion due to the lack of blood flow to the brain. And there are some characteristics that can differentiate syncopal spells or convulsive syncope versus the actual seizures or epileptic spells. Some of them include, for example, most patients with convulsive syncope come back to their usual mental status within a few seconds. They're not disoriented after the spell, i.e. there's no post-ictal confusion, as we say. Most of these patients with convulsive syncope feel sweaty and have either dehydration or heart-related issues or autonomic issues. For example, POTS may be one of them. And so those are some of the telltale signs that patient may be having convulsive syncope. Most patients with convulsive syncope will not have a tongue bite, although some may. Most patients will not have loss of bladder control, although some may, meaning they control their urine and there's no wetting of the pants, if you will. However, in patients with seizures or epileptic spells, that does occur. So I encourage you to ask more questions. Find someone who is willing to spend some more time with you in investigating, as I mentioned, PTSD, some trauma to the brain, whether physical or psychological, often changes these circuits in the frontal lobe and as they connect to the cingulate gyrus and amygdala, which often leads to these disorders. It is not a loss, and there is definite hope here, and we can often treat those patients successfully. Thank you for your attention.